So, you're wondering when is the right time for babies to start drinking water? Well, it's an important question and something that many parents wonder about. When it comes to babies and water, there are a few things you need to consider. First and foremost, it's important to note that water should not be given to babies as a replacement for breast milk or formula. During the first 6 months of life, babies get all the hydration they need from breast milk or formula. Both breast milk and formula are designed to provide babies with the necessary nutrients and hydration they need to thrive. Introducing water too early can actually have negative consequences. Giving water to a baby younger than 6 months can interfere with their intake of breast milk or formula, which are more nutritionally complete. This can potentially lead to malnutrition or inadequate weight gain in infants. Another reason why it's not recommended to give water to babies before the age of 6 months is the risk of water intoxication. Water intoxication can occur when a baby drinks too much water, leading to an imbalance of electrolytes in their body. This imbalance can be potentially life-threatening and has been associated with seizures, brain damage, and even death. However, once your baby reaches the 6-month mark and starts on solid foods, you can begin to introduce water in small amounts. At this stage, babies can start to explore different tastes and textures and can begin to learn how to use a cup for drinking. When introducing water to your baby, it's essential to remember a few key points. Firstly, make sure the water you give to your baby is clean and safe. It's best to use filtered water or boiled tap water that has been allowed to cool. Additionally, avoid giving your baby bottled water as it may contain higher levels of sodium or other minerals that are not suitable for infants. As for the amount of water to give your baby, it's important not to overdo it. Start with just a few sips at mealtime and let your baby guide you. If they're not interested or don't seem thirsty, don't force it. You can gradually increase the amount of water as your baby gets older, but always follow their cues and listen to their body's needs. It's also worth mentioning that during hot weather or when your baby is sick with a fever or experiencing diarrhea, they may need extra fluids to stay hydrated. In such cases, it's best to consult with your pediatrician for guidance on how much water to give your baby. In conclusion, the right time for babies to start drinking water is around 6 months of age when they begin solid foods. Before this age, babies should solely rely on breast milk or formula for their hydration needs. Remember to introduce water gradually, in small amounts, and always prioritize your baby's cues and needs. And most importantly, make sure the water you give your baby is clean, safe, and suitable for their delicate systems.